Warning here, this video is somewhat jarring here and it's going viral. There's a woman in Crown Point, Indiana. She's in active labor, doubled over in pain outside the hospital, and then she was turned away by the staff telling her that she's not in labor as she and her husband were driving to another hospital for the woman to give birth, that she gave birth in the car. Both the mother and the newborn are reported to be in good health. The hospital where she was turned away from is now launching an internal investigation. It is a case that's raising serious questions about emergency care and maternal safety and how often black mothers are dismissed in critical moments. Let's dig a little bit deeper into this and what it means for patients and providers with OB-GYN and nationally recognized leader in maternal health, Dr. Eboni January. Welcome to the show.
Thank you. Thank you for having me.
Dr. January, I have to ask you, what's your first reaction when you see this video?
Honestly, I was quite disgusted. You know, I'm licensed in 16 states, and I will say I've seen some amazing labor and delivery nurses who act very, very quickly. She was in obvious labor. You know, I tell patients when I send them home, if they think they're in labor and they're not in labor, I say, you know, come back when you're one cheek in it. And that means if you can't sit down when you're contracting. And so she was in obvious pain. She's in obvious labor. And the fact that she just sat there and was ignored, it was quite disgusting to me.
Is it up to the staff to make that call, or would it be a physician that would actually make that call whether or not she's in labor or not?
So this is how things go. So when you come into our triage, which is essentially our obstetric ER, we evaluate you, we'll ask you questions, they'll admit you, but if someone is in obvious labor, the first thing that we do is we get help. We get another nurse or a doctor or whomever so that while we're admitting the patient, we can put them on the monitor, assess the baby's heart rate, assess contractions, and then we'll consent her to check her cervix. Once we've checked the cervix, if she's 1-2 centimeters dilated but contracting in obvious pain, we give her some time. 2 hours, sometimes more, depending on how painful the patient or how much pain the patient appears to be in. And then we come back and we recheck the patient's cervix. In many cases, the cervix has not changed, right? But in this particular case, when she is in this much obvious pain, you can admit her for observation, and more than likely, and I've done this hundreds of times, is that they will eventually go into labor, and it's glad that we don't necessarily send them home just because the book says to recheck their cervix in 2 hours doesn't necessarily mean that that's how it's gonna always be. So they should have rechecked her. They should have made sure that she wasn't in active labor, and it's obvious that she was. If she delivered so quickly after, she was in active labor.
Is there a federal law regarding this at all? And if it is, what does it say here?
So essentially, by law, women, if they're in labor, they have the right to be examined immediately. This is the EMTALA law. So hospitals must evaluate any pregnant woman who arrives in labor immediately, no delays, no excuses.
Wow. Is this happening more often than what we think?
And, you know, as I said before, I'm licensed in 16 states, which means I've seen a lot. Black, white, Hispanic, Indian, Amish women, I've seen it all. I don't see this happen a lot. But from what I'm hearing, when people DM me, because I'm very active on social media and I do a lot of education, I have a lot of women who come to me and say that this is happening, that I was ignored, that they made me wait, or they didn't hear my actual issues, my complaints and things of that nature. So it is happening, but the great thing is now we have awareness. I'll tell you, in this particular case where you have the phone, they're recording, whoever was recording, I believe the mom, she should have grabbed the patient's phone and called for a supervisor, a nurse manager, the nurse, the floor manager, the nurse supervisor, and then you can call for a patient advocate. You can actually call for this, and many times these numbers are posted throughout the hospital, and if they aren't, then hospitals need to start posting these numbers.
As we said earlier, the hospital is launching an internal investigation, but is that going to be enough?
I don't think it's enough, right? I think awareness is one thing and investigation is another thing, but now we need training. We're in a day and age, and now one of the trainings that I administer is implicit bias training, culturally competent care training. So I partner with hospitals and community-based organizations in order to do that. And also insurance carriers, they need to train and they need to evaluate often. It's one thing, sure, we have what we call continued medical education, where we have to get training on implicit bias and other things of that nature, but who is evaluating us? Who is making sure that we're actually implementing these things? A one-time training is not enough. We have to take action. We have to evaluate. The administrators and the leaders need to see what is actually happening.
Yeah. Dr. Eboni January, thanks so much for joining us. Thanks so much for your insight. Really appreciate it.
Thank you for having me.